Hereditary elliptocytosis. It is the blood diseases, congenital and genetic diseases. The subtype is pyropoikilocytosis hereditary. Hereditary elliptocytosis, or HE, is a group of disorders of the red blood cells RBC membrane, where the RBC are elliptical shaped and shorten RBC survival. The RBCs in HE lack the elastic recoil necessary for returning to the discoid shape after they pass through the microcirculation. The symptoms of the hereditary elliptocytosis includes jaundice, which is yellowing of the skin and eyes, anemia, fatigue and shortness of breath, gallstones, small stones usually made of cholesterol that form in the gallbladder. Next is splenomegaly, which is the enlargement of the spleen, and aplastic crisis, which is the very low blood levels after an infection. Who gets hereditary elliptocytosis? HE is a congenital disorder. In children with severe signs and symptoms, the condition is often seen at birth and infancy. Individuals with milder signs and symptoms may present the condition during adulthood. Common among individuals of Southeast Asian descent. Individuals of all races and ethnic groups can be at risk. However, some forms of HE are more common among certain populations, such as among Europeans or Asian populations. Risk factors for hereditary elliptocytosis includes a family history of hereditary elliptocytosis is a key risk factor since it is a hereditary condition. Being of Southeast Asian or European descent may place one at a higher risk for certain types of HE than others. The diagnosis includes molecular genetic testing to look for the presence of mutations in the specific protein molecules of RBC. Peripheral blood smears demonstrates the presence of elliptocytes. Complete blood count to measure the various components of blood, osmotic fragility test, and autohemolysis tests. The treatment include folate therapy. Folate helps to reduce the extent of hemolysis in those with significant hemolysis due to hereditary elliptocytosis. Blood transfusion if there is a severe lack of healthy red blood cells. Cholecystectomy, surgical removal of the gallbladder if the pain becomes problematic. And lastly is splenectomy. Splenectomy should be considered only if severe forms of elliptocytosis and after 5 years of age.